Welcome back to Good Morning Idaho, everybody. You know, tumors and cancers can be just as serious for your pets as they are for humans. And Dr. K from Dr. K's Pet Clinic, our visiting vet, joining us this morning. Good morning, Dr. K.
Morning.
You mentioned this topic to us just so people can kind of get a heads up of when to bring their pet into the vet, what they should be looking for. And I understand there are some signs that you can outwardly notice first to know that you need to get your pet in, correct?
Correct. So the first thing is if you see a lump, and that's going to be an obvious skin tumor where it's on the skin and you can tell it's there or underneath the skin, probably the safest thing is always, of course, to take it to your veterinarian so we can look at it. But for sure, if you have a lump and it gets bigger, 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 obviously that's a sign. If the hair falls off of it and it's red and the dog starts chewing it, that's a sign. If it becomes painful.
So a lot of signs that humans
Correct.
have as well. If you have,
Correct.
you know, something that on a human that has a lot of changes, basically,
Correct.
is what you're looking for,
Correct.
right?
And dogs, as they get older, get more and more of them, and so it's hard to pay attention to every single one of them. But I believe, like, if you have a boxer, that's the one breed. If you have a tumor of any kind, take it to your vet, because that tumor generally is not a good one. They're a lot of times are malignant or cancerous.
So the boxer breed is
Correct.
very prone to those.
Correct.
Then. So you want to make sure that you get into that as soon as possible. Of course, just as serious for pets as it is for humans. And once it gets into the vet, you may have a couple directions to go as far as biopsies and figuring out what to do next.
We
right?
have one that we can do, a cytology. We shave it up, prep it. We insert a needle and draw some cells. We can put it on the slide. We can send it off to a pathologist, and they can tell us what it is and give us a pretty good idea. Other times we have to take a full biopsy and we have to anesthetize your pet and remove a major portion or maybe all the tumor. If it's small enough, send it in, and then they can give us a better idea of what's going on. Sometimes, depending on what kind it is, like if it's a mammary gland tumor, sometimes we'll take x-rays of the chest, make sure it's not spread there, or we'll do some blood work. Certainly we'll do the blood work prior to anesthetizing your pet to excise the tumor if it comes down to that.
So definitely lots of options once you get in there. But the important thing for people at home to remember is to be looking for those types of things, especially if you have a boxer. Make sure you're paying attention to those signs.
And so
right?
when it's this size, that's a good time to come in. When it's this size, and
you should have come in earlier.
That's right.
Yeah.
It's like any other cancer thing, the earlier you get to it, better it is.
So make sure you're paying attention. Any changes, anything looking weird there on your pet. And just be safer than sorry. Bring them into the vet and see them. So thank you so much for coming in this morning, Dr. K.